Now, in this first section, we're going to talk about the tools that physicians use. First up is the goniometer. Now, some of you might be thinking, what is a goniometer? And how is this relevant to the medical examination? The picture of the goniometer should be right here. Now, goniometer is a tool that doctors would use in the medical examination to measure the angles of range of motion. So say for instance you have a patient that has a injury that prohibits them from flexing or extending, say, the neck. The goniometer could be used to measure the amount of degrees that the client can move the neck. Now, the goniometer is the gold standard when used appropriately. Now, a red flag that a observer would notice is that the doctor is just eyeballing the angles of the client. So say they flex the neck, right? You're moving down, and the doctor is standing back and eyeballing the degrees. And the legal edge that you can have if a nurse is present and observing, they can write in a rebuttal, say, hey, the doctor didn't use the goniometer to measure the angles of the extension or flexion of the neck. They actually just eyeballed it. So anything that they write down in their report would not be valid because they didn't use the gold standard of the goniometer to measure neck flexion or extension. That's the difference between subjective defense opinion and clinical fact. Another tool that they use is the reflex hammer, which is a picture of it, should be right here. Now, the reflex hammer is used to test reflexes. There are multiple areas on where they can hit the joints to see if there's any type of reflex. And this is something that is predominantly used for orthopedic and neurological medical examinations. The tuning fork, where there's an image right here, is used to evaluate hearing. So you can do the Renee's test or the Weber's test.